Hello my friends, myself Dr. Ritesh Khowal. I'm a consultant optometrist and assistant professor at School of Medical and Allied Sciences, GD Goenka University. In my today's tutorial, we are going to discuss about keratoconus, its sign, symptoms, early diagnosis and treatment option. Before we start, let's first understand who are optometrists. Well, optometrists are the primary healthcare practitioners of the eye and visual system who provide comprehensive eye and vision care, which includes refraction, dispensing, detection, diagnosis and management of disease in the eye along with the rehabilitation of conditions of the visual systems. Now, let's start with our today's talk. Keratoconus is an eye condition that progressively affects the cornea, which is the clear outer layer of the eye, responsible for the refracting the majority of the light rays toward the center of retina. Normally, the cornea is round, clear and dome shaped, providing a smooth surface for even light refracting without any distortion. However, in cases of keratoconus, the cornea becomes thin and cone shaped, resulting in an irregular cornea surface that disrupts the refraction of lights, leading to distorted vision and other visual impairments. Various treatment options are available, such as special contact lenses, which can correct vision and reduce discomfort for individuals with advanced keratoconus cases. In severe cases, corneal transplant surgery may be necessary to replace the damaged cornea with a healthy donor cornea. We will be discussing these treatment options later in our discussion. In our today's session, we will discuss the signs, symptoms, early diagnosis of keratoconus. Now let's understand what is keratoconus. Keratoconus can cause a variety of signs and symptoms that can vary in severity depends upon the stage of condition. Some of the signs of keratoconus include blurred vision. Keratoconus can cause blurry or distorted vision that can cause it to difficult to read or see fine details. Second is sensitivity to light. People with keratoconus may experience increased sensitivity to light, which can cause discomfort or pain. Third is halos around light. Halos or ghosting around lights can be a sign of keratoconus, particularly at night. Fourth is eye strain. Keratoconus can cause eye strain or headaches, especially during prolonged reading or computer work. Most of our people are nowadays doing computer work and can be a cause for the eye strain. Do you experience blurry or halos around the light, especially at night? Do you find it difficult to focus on the object at the distance or near? These could be the early warning sign of keratoconus. Blurry vision is one of the earliest sign of keratoconus. As the condition progresses, halos may appear around the light, especially at night. Difficulty seeing objects in the distance is another common sign. This can make activities like driving, watching a movie more challenging. Irregular astigmatism. The condition often leads to change in corneal shape, causing the irregular astigmatism and myopia. Establishing an accurate refraction and topography is essential for the diagnosis and management. However, the family history of keratoconus increases the risk of individual developing the condition, making regular corneal topography necessary for individuals with a positive family history of keratoconus. Patients who are having the frequent ocular allergies can be another reason. Eye allergy due to any reason and frequent rubbing of eyes cause the weakening of collagen fiber bond present into the stromal layer is proven in studies showing 95% chances of developing keratoconus. Frequent eye rubbing can also be a sign of keratoconus. This can worsen the condition and leads to additional eye problem. If you experience any of these symptoms, it is important to see a doctor for an exam. Early diagnosis and treatment can help prevent the condition from worsening. Now, let's talk about early diagnosis of the keratoconus. Early diagnosis of keratoconus is essential for the effective management and treatment of the condition. There are several tests that eye doctors can perform to diagnose keratoconus. That includes corneal topography. Corneal topography measures the curvature of cornea and can identify any irregularities or thinning that are associated with keratoconus or cornea. Second is the pachymetry. Pachymetry is a test that measures the thickness of cornea, which can help diagnose the keratoconus in its early stage and at the thinning, locating the thinnest point of cornea. Third is visual acuity test. This test measures the sharpness of the patient's vision and can identify any changes or deterioration associated with keratoconus. Now, what are the treatment option or the managing option? There are several ways to manage keratoconus depending on the severity of condition. One approach is to use glasses or contact lenses to correct the visual problem. However, as the condition progresses, glasses and contact lenses may become less effective. Another option is to use scleral contact lenses, which are larger than the regular contact lenses and sits directly onto the white part of the eye. These lenses can provide clear vision and often more comfortable for the patients with keratoconus. Here are several surgical options also which can one look after. One option is called as the corneal cross linking, which involves the applying special drops to the cornea and then exposing it to the ultraviolet light. This strengthens the collagen fiber in the cornea and can help slow or stop the progression of the condition. Another option is the corneal transplant, which involves replacing the damaged cornea with a healthy donor cornea. This is typically reserved for the patient with severe keratoconus who have exhausted other options for their quality of vision. Now, let's understand the risk factors of the keratoconus. One of the primary risk factor for the keratoconus is genetics. Research suggests that the condition may run in families, that certain genetic mutation may be linked to an increased risk of developing keratoconus. If you have a family member with keratoconus, you may be more likely to develop the condition yourself. The second is age. Age is also considered a risk factor in keratoconus, as our immune system is more active in young age as compared to the older age. Hence, our immune system is more active and responsive against the allergies. The third is frequent rubbing of the eye. This risk is very common in the keratoconus and helping in the development of keratoconus. Frequent rubbing of the eyes can cause the cornea to thin and bulge, which can contribute to the development of keratoconus. This is especially true for the people who rub their eye vigorously or who have allergies or other conditions that can cause irritation or itching, such as dry eye. Now, what you should remember, one of the most important thing you should remember which can help in preventing the keratoconus is to avoid eye rubbing. Frequent rubbing can cause damage to the cornea, making it more susceptible to thinning and bulging. If you suffer from allergies or other conditions that can cause itching or irritation, try to manage your symptoms with the medication or other treatment rather than rubbing your eye. Another key factor in preventing keratoconus is to protect your eyes from UV radiation. Exposure to UV radiation, particularly during the adolescence age, has been linked to an increased risk of developing keratoconus. To protect your eyes, wear sunglasses or other protective eyewear whenever you are outside, and avoid tanning beds or other sources of artificial UV radiation. Remember, maintaining a good overall eye health is also important for preventing any eye disease, specifically keratoconus. Be sure to schedule your regular eye exams with your eye doctor or the optometrist, especially if you have a family history of keratoconus or other eye conditions. If you wear contact lenses, be sure to follow proper hygiene practice to reduce the risk of eye infections or other complications. Now, what are the life of patient with keratoconus? Living with keratoconus may also require some lifestyle adjustment. For example, you may need to avoid certain activities that could potentially damage your eyes, such as contact sports or activities that involve heavy lifting or bending over. You may also need to adjust your work environment or make changes to your daily routine to accommodate any vision problems caused by keratoconus. In conclusion, living with keratoconus may be challenging, but there are ways to manage the condition and maintain a good quality of life. One of the most significant impact of keratoconus on quality of life is its effects on vision. As the condition progresses, it can cause significant distortion and blurring of vision, making it difficult to perform everyday activities such as reading books, driving, using a computer. These can lead to feelings of frustration, anxiety, and in some cases depression. Keratoconus can also have a significant impact on social interactions and building relationships. Individuals with keratoconus may feel self-conscious about their appearance or worry about how their vision will impact their ability to participate in social gatherings and activities. They may also experience difficulty with eye contact, which can affect communication and interpersonal relationships. In addition to these emotional and social impacts, keratoconus can also have practical implications for daily living. Individuals with keratoconus may require frequent eye exams, treatments, medications to manage their eye condition, which can be time consuming and costly. They may also need to make modifications to their daily routine, such as avoiding certain activities or using assistive device to aid in daily tasks. Living with keratoconus may be challenging both physically and emotionally. The visual symptoms can make it difficult to perform everyday tasks like reading, driving, and working. People with keratoconus may need to wear rigid contact lenses to correct their vision, which can be uncomfortable and require frequent adjustments. They may also need to undergo more invasive treatments like corneal cross-linking or corneal transplant surgery if the condition progresses. In conclusion, keratoconus can have a significant impact of quality of life, affecting everything from daily activities to emotional well-being. However, with proper management and support, individuals with keratoconus can learn to adapt to the condition and maintain a quality of life. It is important to stay informed about the condition, work closely with an eye doctor to develop a treatment plan, and seek emotional and social support when needed. Keratoconus is a progressive eye disorder that can cause significant vision problems if left untreated. Early diagnosis and management of keratoconus can help prevent worsening of the condition and maintain good vision. If you experience any of the signs or symptoms which I have told earlier, it is important to see an eye doctor as soon as possible for the proper diagnosis and treatment. Despite these challenges, many people with keratoconus find ways to manage their condition and maintain a good quality of life. This may involve working closely with an eye doctor or an optometrist to find the best treatment options, seeking support from the family and friends, and staying informed about the latest advancing in keratoconus management. Overall, the patient experience of living with keratoconus can be complex and multifaceted. It requires ongoing management, emotional support, and a commitment to maintain a good eye health. Before we close our session, let's just discuss some of the myths and facts about keratoconus. Keratoconus only affects older adults. This is a myth. But the fact is, keratoconus typically develops during the adolescence age or early adulthood, although it can be diagnosed at any age. Second myth is keratoconus is caused by reading in dim light or watching too much TV. But the fact is, keratoconus is a complex eye condition that is believed to be caused by a combination of genetic and environmental factors. Reading in dim light or watching too much TV does not cause keratoconus. Third myth is keratoconus may lead to blindness. Well, this is not the fact. The fact is, while keratoconus can cause significant vision problem, it does not always lead to blindness. Many people with keratoconus are able to manage their condition and maintain good vision with the help of treatment options like rigid contact lenses or corneal cross-linking. Fourth myth is corneal cross-linking is painful and dangerous. However, the fact is corneal cross-linking is a safe and effective treatment option for keratoconus. While some discomfort may be experienced during the procedure, it is typically well tolerated and does not cause significant pain. Myth 5 is wearing contact lenses will make keratoconus worse. However, the fact is wearing rigid contact lenses can actually help to improve vision and slow the progression of keratoconus. While it may take some time to adjust to wearing contact lenses, they are safe and effective treatment option for many people with keratoconus. Our sixth myth is keratoconus can be cured with eye drops or medication. But the fact is, while there are some medication that can help to manage the symptoms for keratoconus, there is currently no cure for the condition. Treatment options like corneal cross-linking and corneal transplant surgery can help to slow down the progression of the condition and improve the vision, but they do not cure the condition. By understanding the truth about keratoconus and dispelling these myths and misconceptions, we can help to raise awareness about this complex eye condition and improve the care and support available to those living with this condition. With this, I would like to close this session and thank you for taking time to learn about keratoconus. If you have any questions or concerns, reach out to the keratoconus specialist for proper diagnosis and management. To all the viewers who are watching this video and having the disease or the early sign and symptoms, you are requested to consult your eye doctor immediately. Thanks for watching. For more interesting video, keep watching our channel Suma's Evolution Classes.